everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very small topic that is known as the common record keeping form. Here, as I've told you in the previous session as well, that record keeping is very important. Okay, we must always maintain a record for each and every client. So in today's session, we are going to discuss in detail about these records and how do we maintain them. As we all know that a variety of paper or electronic forms are available for the type of information that the nurse routinely document, right? So here the categories within the form is usually derived from the institutional standards, which one is following, or even through the guidelines which was established by the accrediting agencies. So here, as we all know that there are a variety of maybe paper or electronic form that the nurse will be using through her day-to-day life when she is in this profession, right? So here, while she is documenting anything about the client, the categories within the form is usually derived from the institutional standards of practice or even through the guidelines which was established by the accrediting agency. So the first one here which we are going to talk about is the admission nursing history form. So here, once the client is being admitted to the nursing unit, the first and the foremost thing which the nurse will be completing is the nursing history form. Why? Because this form will be guiding the nurse through a complete assessment of the client's condition in order to identify any relevant nursing diagnosis or in order to identify their problems. So here what happens is that as soon as the client is admitted to the nursing unit, the first and foremost thing the nurse will do is she will be completing the nursing history form. Why? Because it is through this form that will help her to guide her to which care should be provided, to formulate the nursing diagnosis, or even to identify the nursing problem. The second one is the flow sheets and the graphic records. So you guys know what flow sheet is, right? So why do we use this while we are recording, the condition of the client? We use these flow sheets because these allow us to quickly and easily record or enter the assessment data of the client, okay? This flow sheets is used in order to enter the vital signs as well as the routine repetitive care which has been provided to the client. For example, any hygienic measures, any ambulation meal, to record the weight of the client, the safety, and also if the client is under any restraint in order to record or in order to recheck that. And also if the client is under any restraint, then to keep a check on that as well. So this flow sheet not only allows us to, to record or to document these basic information of the client, but this flow sheet also makes it easy for the other healthcare team members to quickly see the patient's trend over time and to quickly assess the condition of the client without spending more time on writing the narrative notes. Why? Because here in flow sheets, we don't need to write everything in detail, right? Everything will be mentioned and we just need to write down. Like for example, vital signs, we mentioned the temperature. You just need to write what is the temperature of the client, what is the pulse rate of the client, right? So this flow sheets, it helps to save time. Why? Because here we will be jotting down only to the point, and also when the other healthcare team members go through the data of the client, it will also be easy for them to detect any abnormalities. It'll be easy for them to know what are the things that the client needs. And also in this way, it will help them to save the time rather than reading or writing the narrative notes. And also we see that in the critical and the acute care unit, these flow sheets are commonly used for all types of the physiological data. The next one is the patient care summary or the Cardex. So what do you mean by Cardex? Here, Cardex is a form that has the treatment as well as the activity section along with the nursing care plan section in order to organize the information of the client for any quick reference. An updated Cardex also eliminates the needs for repeated referral to the chart for routine information throughout the day. So as I've said, that this card deck is a form which has a separate section for the activity, for the treatment, and also for the nursing care plan, right? So this will help to organize the information of the client for a quick reference. So with the use of this card decks, it also eliminates the needs for the repeated referral to the chart for any routine information throughout the day. So with the use of this Cardex form, we can only go through and get a quick reference rather than again and again going through the chart of the particular client. The patient care summary or the Cardex also include these following information. That is the basic demographic data, which include the name, the age, the sex, the educational qualification, the occupation, the marital status, etc. Then the healthcare provider's name and also the primary medical diagnosis. Along with that, it also includes the medical as well as the surgical history of the client, any current order from the healthcare providers, the nursing care plan, the nursing orders, any scheduled tests or procedures, as well as any allergy that that particular client is having. So these are the various things that will include in the patient care summary or the Cardex form. The next one is the standardized care plan. So here each and every institution has their own standardized care plan. These plans are based on the institution standards of nursing practice, which are pre-printed, and along with that the established guidelines which are used for providing care for the patients who are having the similar disease condition or the similar problems. So first, what the nurse will be doing is that she will be assessing the condition of the client. Only after the complete assessment has been done, then only she will start to identify the standardized care plan which will be appropriate for the client, which will be suitable for the disease condition of the client. And then she will be recording this plan in the client's medical record. So here it is not necessary that once you have formulated this standardized care plan, you must only follow the same. But as a nurse, you can also make the modification which is required if you feel like that particular plan which you has been planning, which you have been providing for the client is not sufficient enough. And also here, it is not necessary that once you have formulated the standardized care plan for that particular client, you must only follow the same. As a nurse, you can make modifications in the care plan if you feel that the care which you had been planning, which you had been providing for the client is not helping them enough. Then you can also make the necessary modification in order to help them regain back their health. And the next one is the progress notes. So here, progress notes made by the nurse will be providing the information about the progress of the client health status, about the progress that a client is making towards achieving the desired outcome. So here in every file of the patient, you will always be finding this progress notes. This progress notes is maintained so that the nurse will be able to document the progress of the client's condition towards achieving their desired outcome. The next one is the discharge summary form. So here from the name itself, you can understand, right, that this is a form which is usually recorded before the client is being discharged. Okay, so this is also a form whereby a complete summary of the client's condition, a complete summary of what are the things the client need to follow even after he or she has been discharged from the hospital. So this discharge summary form will include the information such as the medications which they need to take, the diet which they need to follow, the community resources which will be available and which they can make a proper use of, the follow-up care, as well as a person to whom they can contact if they have any questions, if they have any doubt, or even in case of an emergency. The next one is the acuity record. So although this acuity record is not a part of the patient medical record, however, it is very useful for determining the hours of cares and also the staff members which is required for a given group of patient. A patient acuity level is usually determined by a computer program based on the type and the number of nursing intervention which is required over a 24-hour period. So here the patient acuity level is usually determined by a computer program. Okay, so through this computer program of the nursing intervention which is required over a 24-hour period, they will give an idea of the hours of cares as well as the number of staff which is required to deal with a given group of patients. The patient to staff ratio which is established for a particular unit depends on a composite gathering of a 24-hour acuity data. So this is what acuity record is about. So these are a few records which you as a nurse must always maintain for each and every client. However, there are some of the most important documents which will always be present in the patient records. That is the admission sheet, whereby you will be writing all the things why a client is being admitted to that particular hospital. Then the next one is the physician orders sheet, whereby all the orders which was given by the physician will be documented. Then the nurse admission assessment, the graphic sheet and the flow sheet, whereby you will be documenting the vital signs, the input-output chart. Then comes the medical history and the examination, the nurse's notes, the medication records, the progress notes. And if the client has undergone any diagnostic procedure, then also the results from these diagnostic tests which was performed for them, the consent form, the discharge summary, as well as the referral summary. So these are few of the most common document which you will always be finding in the patient's record. There is also one way through which we can document the condition of the client, and this also serves as a very good record keeping. That is the computerized documentation. So through this, the nurse will be using the computer to store the client database, to make any changes in the data which has been collected, to add new information, to create as well as to revise the care plan, and also to document the client's progress. So through this computerized documentation, the nurse will be recording the condition of the client. But through this, it makes things very easier, because the nurse will be able to document all the necessary information, will be able to modify or to make changes, will be able to add, and also to document the client's progress towards the expected outcome. So what is the advantage of this computerized documentation? So through this computerized documentation, it increases the quality of the documentation and also saves time. It also increases the legibility as well as the accuracy of that particular information. It facilitates the statistical analysis of the data which has been collected, and not only that, but this computerized documentation is also a system which links the various sources of the client information. So these are the few advantages of the computerized documentation. However, along with this, there are also several disadvantages. The first one is that the client's privacy may be infringed on if security measures are not used. The second disadvantage is that the breakdowns makes the information temporarily unavailable. This system is also expensive, as well as the extended training period for this is also required in case if a new or an updated system is being installed. So these are also few of the disadvantages of this computerized documentation. And also, whenever you are documenting any information about the client through the use of these computers, you should make sure that the password should never be shared, and also you must change the password of that computer frequently. You should also make sure that all this information of that particular client must not be viewed by an unauthorized person. Why? Because here it is very important that we should maintain the confidentiality of the client, right? So here, whenever you are documenting anything, whenever you are following this computerized documentation, you should make sure that the password of that particular computer must not be shared to any unauthorized person, and you should also make sure that you must change the password frequently. And not only that, but you should also make sure that these information that you have saved on that particular computer must not be viewed by an unauthorized person. So these are the few things that you must keep in mind when you are following this computerized documentation. So we've come to the end of this session. So in today's session, we have discussed about common record keeping form. So through this, we've come to know about what are some of the records which we need to maintain for the particular client, such as the patient summary form, that is also known as the Cardex form, the acuity record, the progress notes, the standardized care plan, flow sheets and graphic records, as well as the admission nursing history forms. And then we've also learned about some of the most common documents which also will be available in each and every patient record. And at the end, we've also learned about computerized documentation along with its advantage as well as the disadvantage. So I hope you guys have got a clear understanding of the topic. I'll be meeting you guys in another session. So until then, have a good day. Thank you.